All right, hello. All right, so myotomes are basically a group of muscles that are innervated by a single nerve root, um, spinal nerve root. And it's different than the manual muscle test because it tests for, you're testing specific to joint motions as opposed to individual muscles. So the procedures for myotome testing, and I'm just going to go down the list. So for C3, that's a lateral neck test. So you ask the patient to hold, and then you don't let you push against the side of their head, which tests for cervical lateral flexion. C4 is the shoulder shrug test. So you push down on their shoulders. C5 is shoulder abduction. So you just have them abduct their arms and you push down. C6 is elbow flexion. C7 is elbow extension. C8 is thumb extension. T1 is finger abduction. So you push inwards to test for finger abduction. T2, there is the medial. I don't think there is one for T2. I don't believe there is one for T2. L1, there isn't one for L1. For L2 is hip flexion. For L3 is knee extension. L4 is ankle dorsiflexion. L5 is great toe extension. S1 is ankle plantar flexion, and S2 is knee flexion. Okay, so for the deep tendon reflexes, let's see here. Okay, for deep tendon reflexes, so basically you're striking different parts of the body to test for reflexes. For the upper quartile, we're starting with the biceps brachii, and you would just tap one of those little hammers, the rubber mallets, in right where the bicep tendon is on the humerus level, I should say. Brachioradialis, same thing. It's kind of like midway down the forearm. You tap right there, and you want to see some kind of movement at the wrist. For triceps, it would be in the back of the triceps tendon right here, and you should see sort of an elbow extension happen. The patellar one is the most famous one. You just strike the patellar tendon right superior to the tibial tuberosity. Okay, thanks. And then the Achilles one, you strike the Achilles tendon in the back. Oh, so the reflexes, you should see a normal reflex action, just kind of like a quick twitch of the muscle. For patients that have lower motor neuron injuries, the score would be 0 or +1, a 0 meaning no reflex at all, so the muscle wouldn't move. And a 1+ would be slightly depressed, meaning like it would move, but not too much. For upper motor neuron injuries, that would be a score of 3+ or 4+, 3+ being an exaggerated response, so like a really strong reflex, and a 4+ is a sustained response. Okay, upper motor neuron, let's get this in. Upper motor neuron testing. So there's 3 tests, starting with the Hoffman's test. The Hoffman's test, you have the patient seated, and you would just grasp the distal phalanx of their middle thumb, and then you would kind of flick it. And the test should be performed bilaterally, and an abnormal response would cause the thumb to flex and abduct, and the other fingers would also flex. And a normal test or a negative test, nothing would happen. And the Hoffman's test is usually it's an indication of dysfunction of the CST tract, and particularly in the presence of compression of a spinal cord in the region of the cervical spine. The Babinski test, that's performed at the bottom of your foot, on the plantar surface of your foot, I should say. And you would either take the back of a hammer or your finger, and you would stroke along sort of the lateral aspect of the foot up until like the base of the toes. And a positive test, the toes would extend, and a negative test, the toes would curl. And and the Babinski test, it basically just tests for central nervous system dysfunction. Lastly, the Clonus test, you take the patient in supine and you have their knee flexed, and you just push on their foot into dorsiflexion, and you should see sort of an oscillation, kind of a rhythmic plantar flexing of the foot. And this is also tested to detect an upper motor neuron lesion in the central nervous system. Okay, thank you very much.